All right, everyone, welcome to Biotech IQ. And today's a little bit different. We're expanding kind of our content offering and the value that we're trying to bring here to the listeners and to the industry. And tonight we're doing a panel on digital health, and we have two leaders and experts in the digital health space. We have Dr. Waqaas Al-Siddiq, who is the CEO and founder of Biotricity. And then we have Omar Manejwala, Dr. Omar Manejwala, MD, who is the Chief Medical Officer with DarioHealth. Welcome to the show tonight.
Yeah, thank you. Great to be here.
Thank you. Likewise.
Absolutely. I'm excited to jump into this, do a little bit something different for the listeners out there. We're recording this, and just so the both of you know, this is actually going to be our first video posted to our brand new YouTube channel that is going to be launching. A little bit interesting thing about the YouTube channel is our goal in the future is basically to do like reviews on companies. So we would actually come out to a company and, ideally get a tour, maybe take some pictures, some video, get a feel for the company culture, what it is that they're doing, and then share that content on social media for potential future employees, investors, whoever wants to see the information that's out there. So thanks for being the guinea pigs on my channel here, guys. Appreciate it.
Very cool.
No problem.
So to kick this off here, digital health is changing. It's changing the landscape of patient care. It's the bottom line, right? And there's some pretty innovative ways to monitor and basically switching from what I've heard in our discussions of from an episodic care to longitudinal, being able to kind of see things across the spectrum as it's going on. So I think this would be a great discussion. Let's go ahead and have, we'll start with you, Waqaas. We'll have you kind of tell us a little bit about your company, maybe tell us a little bit about what you're doing, and then Omar, we can go ahead and switch to you there.
Absolutely. So, kind of what you talked about is in terms of going from episodic care to longitudinal care is really what we're focusing on at Biotricity from a cardiac perspective. So, cardiac disease is the #1 killer in the world. And, when you look at patients, you diagnose them and it's a lifelong illness. And 70 cents of every dollar spent on chronic conditions. And so what's interesting, to me, and I think to people who are in the digital health space is that you've got a #1 killer, but they have no tool available to manage their condition. So what happens today is you get diagnosed, you are put on an antiarrhythmic or a medication, you get a procedure done, maybe you get a pacemaker installed, and then you're kind of left on your own. You're of course given a program. We know how when a doctor identifies a patient and tells them what to do, some of these patients follow that program, but most do not. And then 3 months later, 6 months later, the patient is coming back in and you're trying to manage them. Now, we've seen in the world of diabetes, and I'm sure Omar will speak to it from his expertise in that space, and sleep apnea and some of these other chronic conditions, there are tools available to these individuals. But what does a cardiac patient have? Today, you've got the Apple Watch, you've got these 30-second or 1-minute ECG recording devices, which are for personal use. But if you take and zoom into what does a patient profile look like in cardiac disease, you realize that these patients are generally asymptomatic and issues are intermittent. So how is 1 minute of data really useful? And then how do you bring that data to a doctor and how do they find that useful? And so it becomes this complicated problem. And so at Biotricity, we started at diagnostics, but our focus was really how do we collect additional data and more information to get a more holistic picture of the patient, so that when this patient is coming back 3 months, 2 months later to the doctor has a better insight into what's been going on into that patient and what does that data mean and what is the clinical relevance of that. And so that's what we've been doing at Biotricity. We're really focusing on this idea of bringing longitudinal care to cardiac patients.
Fantastic. Many of us do have personal experience with that. And in fact, very, very recently, my father-in-law had a stroke. He survived. He previously had a defibrillator installed. For a major heart attack he'd had. So cardiovascular health, definitely a big issue. And we've kind of watched this with him as, they found him in his vehicle in the driveway. He gets rushed to the hospital, makes it through that event, and then goes home, and then about a month later, is back in the hospital again with things going on, and they're not sure why, right? And if they would have had the opportunity to monitor that and figure out, okay, what's going on, and then so anyway, I'll stop my story, but definitely a great thing here. So, and Omar, tell us a little bit about DarioHealth.
Yeah, sure, absolutely. It's really really great to be with you both actually today, Waqaas, Ammon. As Ammon mentioned, I'm Omar Manejwala. I'm the Chief Medical Officer for DarioHealth, and I've been with Dario for about 2 years. Prior to that, I was the Chief Medical Officer of a company that we scaled from zero to about $500 million, selling into the payer space in behavioral health. So yeah, and I do want to say this before we dive in, Ammon. I've been listening to your podcasts, and they're really cool. I caught a great one on applications of behavioral psychology and why we resist. And so I think you're tackling some great concepts. And I also think this move into video and going to the company is really cool. So I just want to say that before we dive into the company. So yeah, DarioHealth, DarioHealth exists for one reason. And that's to make the right thing to do, the easy thing to do. So what we do is we deploy user-centric, integrated, multi-condition, digital, device, and human support at scale to really drive whole health improvements for our members with chronic conditions. And we have a very long sort of direct-to-consumer history, and we still have a direct-to-consumer channel. So that enables us to do it in a really consumer-centric way. I mean, one of the big challenges with digital health is always, will people actually use it? Will they do it? Will they engage? And so having that direct-to-consumer DNA and that longitudinal data set that feeds into our AI enables us to have a mature AI in that area. And so today what we do is we do that, as Waqaas mentioned, we do that for diabetes, we do it for pre-diabetes, we do it for obesity, hypertension, and musculoskeletal conditions and behavioral health conditions. So those are all conditions that are costly. They're conditions that are behaviorally driven, and they frequently overlap with each other in the same person. So we call that comorbid or co-occurring. So, and what we've seen in the space is that customers tend to partner with us because they're frustrated with managing multiple sort of point solutions and the complexity of that. They're frustrated with the lack of real-time access to data. They've been burned maybe by low engagement in the space or high attrition with folks. And they really are seeking kind of value-dependent partnerships that drive durable, long-term improvements in their stakeholders with chronic conditions. So that's a bit about Dario, and yeah, super excited about the conversation today.
Yeah, great. Yeah, that's another area that most of us have experience with as well, right? I think it would probably be a pretty safe assumption to say we all know someone that has diabetes or that suffers from obesity in one way or another. So
chronic pain,
chronic pain.
Yeah, right. Exactly. It's very common. Very common.
Yeah. The other thing that you mentioned that I also find pretty interesting. I actually did an interview earlier today with an individual developing diagnostics, and he made comments about personal care. And so I feel like what it is that both of you are doing is you're putting power back in the hands of patients as well as in the hands of the doctors who are helping to treat those patients. So it's awesome stuff. We've got a list of questions here tonight that we're going to go through, to kind of discuss digital health and its landscape and what it's doing to change things here. So let's go ahead and kick that off. Let's get it started. So Waqaas, tell me, how does digital health fit into the landscape of patient care? And on the side of, say, treatment development?
Yeah. So, I think that, of course, recent global events, pandemic, we've seen a huge rise in telemedicine. We've seen a huge rise in digital health. And, I kind of touched on it in my intro where you're talking about a patient. So think about a patient's care journey, right? How does that journey start? Where does it go? And where does it end? And most of these journeys, especially in the chronic space, they start with a visit, a diagnosis, maybe begins at telemedicine, maybe begins at an in-person visit where you get a referral to a specialist. But the majority of your life is lived in a lifestyle struggle, right? Where your doctor's telling you do this, this, and this, you go, you fall off the wagon, you need this feedback. And, Omar was talking about the behavioral aspect of it. And what we see is that a feedback loop is really required, right? And in engagement and in interaction and in a communication structure that allows individuals to engage and not only see what's going on and what's affecting them in a positive way, but also in a negative way. And then this goes in and translates to your physician, and they are able to look at this data so that when they are visiting you, they have better insights, but they can also take action and readjust the care plan or readjust what they're trying to direct you based on actionable, clinically valuable data. So digital health is really that facilitator, right? It's sitting after diagnosis to help you manage and really deal with all of these little points. And it's a multivariate, right? Because you've got what the physician is telling you, you've got personal behavior, you've got behavioral management, you've got lifestyle issues, and all of these environmental factors that are impacting. So, and you've got a condition that there really is no cure for. So digital health, in my opinion, is really about how do you, provide data and allow individuals to consume healthcare who are chronic within the comfort of their home, and making that data available to your care team or your clinical provider so that they can actually make more informed decisions. And then for people who aren't chronic, digital health is really going to allow you to consume as much of the healthcare as you can from the comfort of your home. So I'm thinking, lab works, pre-screening, doing your data. So providing all of that information. And then you go into the hospital for interventional work that requires you to, the physician to actually get their hands on you or get the team on you. But that's where I see digital health, right? It's really trying to get more and more of care delivery and facilitate care delivery within somebody's home. And I think the big win on that is going to be on the chronic space.
What do you think about that, Omar? Fitting into the landscape, right? The patient care on one side, treatment on the other.
Yeah, I think, well, first of all, Waqaas is exactly right. So as a doc, I can tell you, docs have been trying to get folks to do things differently forever. And we do it with shorter and shorter periods of time and more pressure. And it's very complex, but bottom line is we're trying to get folks to do different things in between the visits. That's what we want. That's what we've always wanted. So there's no friction there. It's really seen as a win from the provider standpoint because it's a tool that people get excited about, that the folks who are using these things get excited about, that they can actually do those things so they don't have to come back, as we've all had to do with our head hung in shame and say, no, I didn't finish my prescription, or I didn't lose weight, or I didn't do X, Y, and Z. And this is a way of removing that and saying, no, you get the support you need and we're not going to shame that. In fact, we recognize that that's a deficit of the system. We all talk about healthcare, being broken, whatever that means. The bottom line is we have massive investment, no return on that, and we're not affecting the changes we need to. So the way I look at this question, I think it dovetails very well with what Waqaas had said, which is that, you put users at the center of this rather than at the periphery. And what you end up with is a consumer-centric kind of view where people can actively participate in their care. And they aren't beholden to complex and confusing, ineffective and periodic kinds of care. So the opportunity here is to really empower change in the things that really need to change to drive, not having those readmissions and not having those ER visits and not needing very, very expensive advanced diabetic therapies that can cost thousands of dollars, or not needing surgery or hospitalization or suicides, or all the things that can be the outcomes of this. So the general idea is be proactive, deliver care continuously rather than intermittently, and drive the kinds of improvements that are a win on both sides of the coin. Win for the providers who've been trying to do this all along, and of course a win for us, the people who use these things as well, who really, are trying. We're trying. I mean, it's not an educational deficit, right? It's not everybody knows don't eat the pie, but yet the pie shows up and I eat the pie. I mean, so it's, to put it very, very simplistically, I think that healthcare has focused an enormous amount of resources on education and very little on helping people actually change, unfortunately. And digital health has an opportunity to help that at scale. Yeah.
Yeah, it's like you have the opportunity to be there when someone's actually participating in the habit that may be leading to a chronic condition, right? Versus the episode of this is the outcome of that habit.
Leading to and also worsening it, right? And so it's both primary, as we say, primary, secondary, and tertiary prevention. So making, keeping it from getting worse too. Yeah, exactly.
Yeah, absolutely. Yeah, it's easy for people to not realize what's happening when they get caught in their cycle of how they do things daily. And I really, again, going back to the being able to monitor and have data and put that in the hands of everybody involved so they can see and make decisions better. So maybe, Omar, you could tackle this question or start tackling this question for us, which is for most individuals that may not have a clear picture between the difference of telemedicine and digital health. I think it's probably pretty easy for people to look at the technology and just kind of all see it as one thing, right? So how would you, I guess, define the difference for us?
Yeah. And I'm going to break it down very simple. I mean, we can go as deep into this as you want to, but here's the simplest differentiation here. Telehealth changes the site of care. Okay, you get periodic care, you get a visit, maybe you get this visit, you drive down the road, you go to this parking lot, maybe you go to that building, and now instead of going to the building, you go to a spot in your home or something like that. But telehealth really just changes the site of care. That's it. You're getting that care, that same care, in a different location. And most of us who are in the know that simply changing the site of care cannot solve the fundamental problems of healthcare. I mean, that's exceedingly naive if you think that that's good. It's very helpful. I mean, it's been great with it's been essential with COVID, and there are some things where it really is more comfortable and better to do it at home. Some things should be in person. It's just like anything else. The site of care may need to change based on a person's needs, and that's a great thing. But nobody should operate under the illusion that changing where something happens, in some sort of periodic event where that happens, that's going to all of a sudden solve readmissions and ER visits. So telehealth changes the site of care. That's good. Digital health changes the nature of care. The very nature of care is altered. And so then instead of being one-to-one, like me treating you, it's one-to-many. Many people can be treated by an individual and supported by. Instead of being periodic, 8.5 minutes, you drive to a place, or maybe you jump on a Zoom, you wait for your slot, and then you go in, you get your 9 minutes or whatever it is. Rather than being periodic, it's continuous. It's always there for you. It's there for you when you need it. It's there for you when you don't even know that you need it or don't even think that you need it. It's integrated into your life. It's integrated into the thing that you touch several hundred times a day, which is your phone. It helps with all the stuff, as I mentioned, that docs have been trying to do all along. Unlike telehealth, where there is a face-to-face analog version of it, there's a face-to-face correlate of telehealth. There's no analog correlate for digital health, really transforming the very nature of care itself. So that means we can deliver at scale, continuously around the things that actually matter, with the person in control, with the user, the member in control of this process, being able to see their data, being able to see that intelligence, getting the support they need to change. And that can be done at scale. Telehealth cannot do that. So these are two, I think, very fundamentally different technologies that work well together. And they're both very, very good things. But really what we're talking about with digital health is something transformational that can really finally achieve some of these outcomes that have been out of reach for healthcare for many years.
Yeah. Anything you would add to that, Waqaas, or is that a pretty clear definition?
No, I think Omar hit it right on the head. I mean, I would add one point, which I think that digital health as a transformational ecosystem is really about care delivery across different groups, but it will actually create a massive impact in the chronic world, more so than a telemedicine, because when you go into telemedicine, I still view it, or telehealth, as very, it's one-to-one, it's episodic based care. What are you going to do with the diabetic or a kidney patient or a cardiac patient? You need lipid profiles, you need metabolic panels, you need mineral deficiency information. So where it's great as a facilitator, it's great as a one-to-one to discuss something that is that has come out from a digital health. It is really focused and more applicable for the episodic based, non-chronic. And whereas digital health for me is just more wide, it can touch everybody, it can facilitate everything, and it's continuous.
Great. So maybe you could tell us, and now that we kind of got that clear definition, has COVID had an effect on the market of digital health itself? Or rather, I should say, what effect would you say, Waqaas, has COVID had on the whole landscape of digital health?
So I think two things have happened, right? One is it's completely accelerated adoption, right? In many ways, right? From a governmental perspective, from CMS, we've seen how quickly FDA, CMS, everybody got on board. They removed the laws, or telemedicine before COVID. The parity law was across different state lines with different regulations. So all the regulations and the barriers got flattened. FDA came out and they became more open, and they started reclassifying things to facilitate digital health. So the front and center, and digital health as front and center of your mind. And as Omar was saying, it really helped people. It was really accessible. It still provided care delivery. So that transformation from a regulatory perspective, from a hospital system, a clinical perspective, so it accelerated adoption and behavioral change. One of the most important things that I think it also did, it enabled individuals to test and play around with things. If you, and I'm sure Omar can speak to this better than I can, but if you asked a patient before the pandemic to go and download an app and figure it out and play around it, it's impossible, right? And during the pandemic, they've got 4 different telemedicine downloads, depending on which, if they're dealing with Walgreens, or if they're dealing with their a generalist, or if they're dealing with a specialist, and depending on what system and where they're consuming. So all of that, in terms of users being able to and interested in playing around with technology, being able to deal with issues and still try, I think that was transformational. So, I'm very excited about the next couple of years and the next few years, because that was what was missing, right? Can individuals really, and are they willing to play around? Because usability is everything, right? And now you're going in and you're changing everything. And we were forced in this situation. And across the channels, we've reduced barriers, and everybody's open to trying things.
So it was a catalyst in a lot of ways. How about from DarioHealth's perspective, Omar? What was it that you saw change?
Yeah, catalyst is actually a great description for it. And I agree with Waqaas. We went from tens of thousands of users to hundreds of thousands of people on platform. We signed over 50 clients just in the last year. Health plans, national and regional, employers, providers. I mean, we've seen very dramatic uptake. And even when you saw telehealth dip back down, when we had that little gap prior to the emergence of Delta and other areas where telehealth will be a little fungible. I mean, there will always be a base amount that I think has opened up as a result of this, but you do see ebbs and flows based on how much people are willing to go into offices, and also based on what condition. But with digital health, it's just been, up. And what we see is that as folks see the value, as the value gets unlocked, where I start to realize, okay, because convenience really drives a lot of this. When I start to see, okay, oh, wow, this thing actually works. It's easy to use. I don't have to disrupt my life. I can use the thing that's right there. And most importantly, it's not built like, not to pick on portals, but like when you go to your health plan portal or something like that, that's not a place you're going to go frequently because you like it, because you want to be there. Whereas if it's really consumer driven, like Facebook or TikTok, if it has that kind of feel of like, all right, this is bringing value to me, I want to go there, then that sort of thing really kind of takes off and accelerates. And that's also why we've seen, like, we got 30% of our users are over the age of 65. 1 in 5 lives in the lowest socioeconomic zip codes. We have Spanish language outcomes. So we're really seeing a lot of uptake among folks that you would think to yourself, that's not going to be a digital health person. And yet, because we make an effort to maintain a lot of backwards compatibility to older devices, and we also design our user journey so that they can be synchronous or asynchronous. We have a lot of folks who don't have broadband access. The way they access the internet is the Walmart or the Wendy's, and so being able to deliver for them, So I think we've seen a massive increase as a result of COVID-19, but unlike telehealth, we're not seeing the dialing back or the ebb and flow. We're just seeing up.
Yeah, very interesting. Interesting points. I mean, it's 2022, right? And, I don't mean to sound pretentious maybe, but, you would think everybody has internet nowadays, right? Everybody. Yeah. Apparently that's, it's still in some places not the case.
It is a social determinant. Broadband access is a social determinant of health. Yeah,
absolutely. And that's why you've got some of these programs that and the Biden administration was coming out with, and even before, in terms of, rural access in America, suburban access is still a huge problem. And then when you bring in specialty care into the mix of it, this is why digital health is so transformational, because access to specialty care, when you have a broadband problem, now you want specialists that are going to go in and service the far suburbs or the far rural. It's close to impossible because you just don't have enough individuals. And so there's a gap in care, and digital health can fill that gap because it can make specialty care more accessible and available.
Absolutely. I, previous to getting into recruiting as a full-time, well, I shouldn't say getting into recruiting. Previous to getting into the biotech world in recruiting, I specialized in physician recruiting, and I worked for a big $1 billion third-party recruiting company. They did a lot of locum tenens, and then and I worked in the permanent placement team. But and then I worked for a small startup for a couple of years doing something very similar. But the point I'm getting to is that a lot of the clients that were willing to work with us, that were like, yeah, we'll pay you to help us find people, right? It's when it came to the physician world, it was the cities never needed us, right? Most of the time, I shouldn't say never, but most of the time, most doctors, when they get out of school, they want to go to LA. They want to go to Orange County. They want to go to New York City. They want to go, to you name a major urban center, and they want to go there, right? But try finding a doctor in rural Iowa,
right,
where the nearest clinic is a community health clinic. It's not even a health system that is turning out profit. It's community health based. So interestingly, we had a number of clients that were small community health clinics, that it's like, man, if you could just find us, I know you mentioned specialty care, but man, if you could find us a primary care physician out here,
right,
and so, yeah, we definitely saw that. And then the specialties, you're right. I mean, even from there, it just compounds, I think, the access, right? And the physicians are overwhelmed, right? Overwhelmed with trying to treat patients. And so there's a lot there for sure. So I think we've kind of answered this question. The next question that we were going to ask here would be, how significant is the need for digital health? Right. I think I think we were just answering that. Did you have something you want to comment on that, Waqaas?
Yeah, I was just going to say, to your point about the importance, and I think Omar really hit it home in terms of behavioral health, right? Like, how can we really facilitate, and the only way to do that is continuous care. I mean, doctors have been trying this forever, and digital health, the importance of it in terms of behavioral health, and also 70 cents of every dollar spent on chronic conditions. And I'll kind of share my own little story. I mean, my cholesterol was like 320 or something, but I brought it down to 185 in 3 weeks. Now,
wow.
I'm an incredibly organized, and when I want to go after something, I go after it religiously. And my doctor, he's never seen that drop like that. So he was like, oh, it must have been a lab goof up. But I know it wasn't a lab goof up because it was trending upwards. And I know exactly what I was doing, which was eating too many cheeses. So, imagine now you've got non-compliant, non-organized, and we talk about socioeconomic issues, and all of these, right? And then you've got a doctor who's like, listen, you really need to listen to me because I know, right? And that's where, that level of importance for that behavioral and that feedback, it's most important thing we can do right now.
Yeah. Fantastic. Well, let's move to another question here. And we've kind of been touching on this as well. And that is points of friction. So what are the points of friction other than access that we've talked about here, getting consumers and physicians to use these new digital health tools? And Omar, let's go ahead and kick the question off with you.
Oh, sure. Yeah, no, listen, I think that's a great question. The first generation digital health tools that were out there, most of them were not consumer centric. Most of them didn't have experience working and engaging, people who were using them, direct to consumer kinds of things. So they were very clunky. They continue to be clunky. I think many of them that are out there, they're not really user centric. Or a person needs to navigate to many different places just to be able to get, what they need. They're not personalized, or if they are personalized, it's very static, like a fingerprint where, because the standard digital health playbook is collect a lot of data, build a few personas, then make a few user journeys, like maybe 6 to 10 user journeys is kind of the standard. I mean, you go visit Silicon Valley. That's what you're getting out of digital health right now. And then they call it personalized, and it's not exactly set it and forget it, because they'll go back every few months when they see data and adjust it very, very manually, but it's not dynamic, and it's not really applying AI in the way that it could be to drive value. So I think that's a point of friction too, because at the end, if you think about just yourself, maybe some behavior that you tried to change, some habit you tried to work on, we change from time to time, from month to month, et cetera. So the fact that you matched me with some, person in my age range who has Indian background, who, has approximately the same conditions as me, and maybe the same utilization, that person may be willing to do burpees and I'm not. That person may want to eat a certain way and I don't. That kind of matching, which is very rudimentary and demographic and static, that is, I think, the dirty little secret in digital health, which is the first generation solutions are calling that personalized, but it doesn't fit me. And if it doesn't fit me, I'm going to delete it. I'm going to delete the app and I'm going to stop doing it. So I think one of the biggest points of friction is solutions that are not personalized to me and that don't dynamically adapt with me as I change over time. And they're not user-centric and they're not easy to use. They feel a lot more sort of like, a portal you need to go to look up your benefit or something. It's not really, doesn't feel like a consumer-centric kind of, it doesn't feel Amazon, it doesn't feel TikTok. It doesn't feel like the sort of thing that I would want to use to come back to because it's driving value for me. So I think that's a big point of friction.
Interesting. So anything you would add to that, Waqaas, in terms of maybe something you've seen specific with your technology or how you've been developing, anything that you're seeing?
I think Omar covered most of it. I mean, I could add one thing, which is, when we're talking about personalizing, exactly right. I break that down into two areas, right? Usability. So we really got to work on usability. First generation, it's just, it speaks to, that personalization, that idea of this is something that, I can engage with and that's all around usability. And then there's a feedback loop, right? How does that feedback loop that in terms of my action item, to Omar's point, are you willing to do burpees or not willing to do burpees? So if you're not willing to do burpees, don't tell the individuals to do burpees, right? So that feedback loop and tying that feedback loop to an actual clinical outcome is very, very important. And then the third area, which I think we are still missing, and some companies have really figured it out, some companies haven't, is what is the clinical value of what you're providing to the physician? I mean, giving a physician a big report of my Fitbit steps, they don't really care, except that they know that you've been walking. Their net conclusion on that is, okay, you've been walking, great. That is not information that presented in that way is meaningful. So those are the three kind of friction points that I see is really, because you want the clinical and the care team engaged. So you need to provide them clinically relevant data, but you can't do that if you don't have a usability where the patient is engaged. So they sort of go hand in hand.
Yeah. Omar, you mentioned a couple of times now, I've heard you use the term, it's not TikTok-y, it's not Amazon, it's not, whatever, Instagram, insert,
Right.
whatever tool, or not, I say tool, but, a social media app that we're using
Right.
to do whatever it is that we do. So I'm curious, I know, so for example, with Waqaas Biotricity, you have very specific diagnostic devices that can be used to gather information. But when I hear the term, that it's not like X social media platform or X, shopping platform, that makes me think a little bit about cost and how digital health tools make money, other than saying, well, I'm gonna, we're gonna prescribe this tool to the patient. They're gonna go home, they're gonna use this, and then it's covered through insurance and things like that. So I guess the question I'm getting to is, how is revenue driven? Because it's not a dirty secret necessarily. I mean, companies create value and they generate revenue and they make money for investors and they provide value for their customers, their consumers. So how is it that your tools are generating a revenue and at the same time, I think we've touched on value, but at the same time, value to the patient?
Yeah. So, I think, first of all, this is a great question. And not to go to the first part of it, not everything should look like TikTok or Amazon or anything else, but things should look the way they need to for the application that they're delivering, right? There's a reason that LinkedIn doesn't look TikTok-y, and there's a reason that TikTok doesn't look LinkedIn-y, and there's a reason why Amazon doesn't. So, but at the end of the day, you're going to go to those things because they drive value for you. They're relevant in your life. They have usability, as Waqaas said, and they've been hard cut from consumer DNA, from consumerized kinds of approaches, not someone sitting down saying, okay, here's a place where you can log in and look at information. That's a very broken kind of approach to things. So, in terms of covering the cost, I mean, there's so many different models where some are prescription reimbursement and others. Our view generally at Dario is, look, remove the gatekeepers here, right? So you want to give people access to these tools because they drive value and they save costs. So and there's approaches that involve, from a regulatory standpoint and adding in new codes, and there's all sorts of angles people are taking in terms of trying to get these things covered. But to break it all down to the most basic level, the people who bear the risk of folks getting sick, the people who bear that risk, which is hospitals, which is health plans on their full risk side of business, or employers when there's ASO, or if they're self-insured, the federal government, others. The people who bear the risk of someone getting sick will see value in covering these services. And so if the agreements are value-based, if they deliver value directly to the risk holder's bottom line, then our experience is that whether it's an employer or a health plan or an integrated provider system, they will find the correct best path to reimburse things that affect their bottom line. And we see so many different paths where we get covered as a provider, we get billed through the client. I mean, there's all different approaches we can use, but fundamentally building a digital health company essentially that is agnostic to some extent to those things and can really, we can be reimbursed in a number of different ways, but the most important thing is aligning our value to the value of the risk holder. And that alignment is necessary. So we will not settle on any one particular approach to having this covered, but I will say that the general approach of requiring prescription digital therapeutics is overly cumbersome and administrative and probably not the fastest path to growth. Yeah, that's how I look at it.
Interesting. Waqaas, how does Biotricity, or what is Biotricity's approach to this topic?
I think it's very similar to what Omar was saying with Dario. I mean, we don't attach ourselves to one particular modality in terms of revenue generation. What we really focus on is value-based care and clinical outcomes and clinical value, right? If you can show the system, if you can show a physician that, at the end of the day, you are providing a better service that leads to better outcomes, that allows you to get better clinical data, then you're going to get a payment either from the individual. You're either going to get a payment from their employer. You're going to get a payment either from the provider, or a payment from the insurance company. I mean, we've seen providers subsidize physicians themselves because they're invested in the care of their, especially the independents, where, if a patient hasn't met their minimum and the insurance comes back and they're like, okay, doctor, you got to send this $100 to the patient. Many times they don't send the $100 bill to the patient because that patient's been with them for 5 years. And they're like, listen, I got that data. I was able to get you in. I was able to do a procedure. And guess what? You didn't have a stroke, or you didn't have this fainting episode or whatever that would have ended you up in the ER. So, I think that point is that, fundamentally, we have to focus on, are we providing value and are we providing better outcomes? And does that ultimately lead to better care and a patient that is healthier? Then the revenue stream will come.
Mm-hmm. Mm-hmm. Yeah. So what I'm hearing is, if we focus on getting the right outcome that we're looking for, then the revenue follows, right? Both of you are experienced enough to know that when you sit down with, a VC firm, or you sit down with, investors, of course, they're one of their main focuses is to look at the numbers and how things are set up and all of that. So, these are fair questions, I think, that those listening may want to know a little bit more about. So how would you describe the potential growth opportunity to the market of digital health? I know that, Waqaas, you were saying, in Omar as well, both of you have seen a huge amount of adoption of these technologies throughout the COVID pandemic. How would you describe that growth opportunity now, Waqaas?
So I would say, there's obviously been exponential growth. And I think what you made a very good point about, VCs and investors, they want to see how are you going to essentially get you the revenue stream. So this idea of, okay, you're going to build something. So, I think that, if we take those two components together and we look at it, and so yes, everybody will agree digital health is a massive opportunity. It's not just in the United States, it's a global issue. Things are getting more connected, things are getting more digital. Now, you have to pick an area, right? You can't be everything to everyone. And they always say that, right? You have to pick an area and say, okay, I'm going to go after this condition or this particular issue. And then what is your revenue stream strategy? I think VCs and I think investors themselves, they need clarity in terms of your approach to achieving outcomes and be a business, right? So, if you want to go after employers as a payer, then you need to understand how are employers looking at their bottom line and what clinical outcome is meaningful enough for them to pay for whatever you're trying to build. If you want to go after the reimbursement, which is longer period, you have to build a code and stuff and do all of that process. Again, it's not meaning you can't do that. And it's not meaning that a VC will not invest in it. It's just understand it's a longer cycle. You're going to need more data. You're going to have to do the same thing. And so what that means is that when you're going in and you're planning that out to a VC, you should have that understood. If you go in and you're asking for capital and you're like, there's this huge opportunity in digital health, and they ask that question and they're saying, okay, well, where's your business model? Where's your revenue stream? And you have 3 different options and each of them had 3 different timelines. That's not going to work. So, I think that you have to always balance the opportunity with, you have to be focused in terms of what problem you're trying to solve, and you need to map out the timeline and your approach to generating revenue. And I don't think that investors are never necessarily going to balk if you have a strategy that is longer, but just know that is your strategy and be clear about it.
Mm-hmm. Anything you would add to that, Omar, in terms of opportunity?
Yeah, the Dario side a little different. I think because we're a publicly traded company, I'll say that the overall penetration of the market for digital health is still in the single digits. It's in the low single digits. So the opportunity remains huge. If you use the most conservative methods for assessing the size of the addressable market for the conditions we cover, it's still at least $200+ billion kind of market. You got 147 million Americans who have chronic conditions. 1 in 4 of them have 2 or more. So our multi-condition approach, I think, is very attractive and paints a growth picture. Together, it's costing about $3.7 trillion a year. And then if you look at sort of how we think about, the opportunity across the health plan channels, both the full risk, the government business, and the ASO. If you look at the employer channels, and then the integrated provider kinds of channels, all of which have clear opportunity for digital health. Companies that are capitalized appropriately and can deploy against these various channels can have access to significant portions of this addressable market. And so that's how I would look at the growth opportunity, which is basically staggeringly large. It's the kind of growth opportunity that you saw with, I think, and in no way being exaggerated about this transformational kind of growth opportunity like you saw with Apple and Amazon and others. And I think you have that kind of growth opportunity for the right players who are solving the right problems in the right way. And for them, yes, I think so.
Yeah. So I should mention Biotricity is also publicly traded. So I guess my question about VCs and investors is kind of more of general. Both of you are likely past the stage of looking to get VC investment. There may be still some involved in terms of the shares on market now and all that. But anyway, so what I'm hearing is that there's a massive opportunity right now for people, both to solve problems and to take advantage of the growth of that. But it also is important to focus in on the specific areas. You can't be the person or the company solving, creating digital health solutions across every disease space necessarily, right? Or every market demographic per se. Maybe not market demographic, but maybe I guess disease space would be kind of in my mind how I would classify the differences there. So
at least on its starting point.
Yeah, right. Grow.
Yeah, I mean, for us, we sort of hone it down to those conditions that are a pain point for our customers that tend to overlap and for which behaviors are the drivers. So we're not going to touch cancer, for example, or other areas where it's not largely behaviorally driven. So I think you have to. I agree with Waqaas completely. You have to define the area that you're going to go after, and then you have to go after it.
Yeah, that makes a lot of sense. Well, we are coming up on the closing here. I was going to ask a question about security concerns. I mean, in today's digital world, I mean, it's a risk. I can't tell you how many times I've probably gotten an email, a handful of times, that I've gotten an email that says, hey, we think your information was in this place that was hacked or whatever. I've got identity theft protection plans from like different credit bureaus and whatever, because of all the stuff. So I know that that's generally something that's a concern for some people, especially probably some of the older demographic, right? How do you address that concern with them? Like, how do you put them at ease about it?
Yeah, so I think there's a couple things here. From the member standpoint, it's about building trust and relationships and being very transparent and explaining things simply. Then if you look at dealing with health plans and employers and others, you have to pass a level of scrutiny on security, which I know Waqaas has had to go through too. I mean, we all have to do it. One of the areas that we focus on is something called, just to use an example, like SOC 2 Type 2 reporting, which is a technical term, but basically the general idea is getting, independent third-party auditors to assess your product around the areas of things like security and availability, confidentiality, privacy, and generating internal controls reports that look at how are we safeguarding data, especially when we're using third-party services, when we're cloud-based and using third-party technology services. How are we safeguarding that data? How are the controls, and how well are they operating? And so essentially there are many different approaches like that to generating trust, to ensuring that our partners feel comfortable and secure. And I think, if you're operating in the realm of digital health, these things are table stakes. You simply have to do them to participate, because we're our currency. I mean, we're trading in the most sensitive kinds of data that people have. And so people have to be able to trust us. Those investments are really key. And I know we focus on those. I'm 100% certain that Waqaas must do so as well. So.
No, exactly right. From Omar's, comments, to play in the realm, to play in digital health, it's status quo. You can't play the game if you aren't. You can't even build something if you aren't compliant. You aren't doing the audits. You're not having the proper authentication procedures and building the right auditing trails and relationships. And then, I would just add to the thing that, he was talking about transparency. Transparency to the user is more of a problem that I'm always looking at, because what I find is, just as Omar said, to be in this realm, there's a bunch of things that you have to be. You have to have these audits, you have to be secure, you have to have independent testing, you have to have all of that. Okay, so you've established that. But the users are a whole nother group of individuals, and their mindset and their thinking, and they may not be aware of all of these audits and what these acronyms mean. It's a different game. And there, what I find is you have to really explain that, yes, things are secure, but things are secure to a point. And to your point, they're getting these emails about breach, which scare them. But the other thing is that you also and that's where transparency comes in, because at the end of the day, we give up our freedoms every day for a clear ROI or a clear understanding of what we're giving up our freedom for, right? You get a state ID because you want to be able to drive on the road and not get pulled over and have a problem, right? That's you're willing to give up your identification to a state body for that convenience and that benefit. Same thing in terms of, when you're getting in car insurance or home insurance, or, any type of transaction, you're willing to use a credit card because you don't want to carry cash, but you're willing to take that risk of being of having a breach of your data. So, but that's very clearly understood, those convenience. And I think that as companies, especially in the digital health, we need to make that very transparent and clear in terms of saying, look, yes, we have all of this stuff. Yes, we are very secure. Yes, we're doing all that, but there is a risk. But here's what you're gaining. And I think that goes back to what Omar was talking about earlier, is saying, hey, don't put me into 6 different personas, make it personalized, make it truly usable for me. And so now it becomes like, okay, I am getting the TikTok of digital health. I'm improving my life. I'm seeing their good feedback. Yes, I understand that there's a risk, but I'm going to do it. And that's the user issue for me, is the biggest area that we really have to focus on as digital health companies.
Yeah. Well, with that, thank you both for coming on. It's crazy. I look at the clock here and I'm like, you start getting in the discussion and talking. I mean, it really does go by pretty quick. So I appreciate you both coming on, donating time to help Biotech IQ grow. And hopefully you listeners out there that are watching this or listening to it, you can actually, I'll include links into the show descriptions and all of that, so that you can go do some research on the websites, look at what opportunities are there. And, perhaps there's some type of connections that can be made, otherwise. So again, thank you both for coming on. And, I want to say real quick, for the listeners out there, we've got an episode actually coming out this Friday. It's part of our What's Ahead in Biotech 2022 series that I've been doing to kick off the new year for this first quarter. And so Waqaas's episode will be coming out this Friday. In Omar, while we're here in the public, I'd like to give you an invitation to come on the show sometime, do an individual episode.
Let's do it.
Yeah,
awesome.
That'd be great. All right. We could talk about your book there in the back, Craving. So good. All right. Well, again, thanks to both of you. And we'll look forward to having you following along and seeing how you guys do in the future.
Thank you.
Thank
Have
you.
a good one.